Welcome to Dialogue on Public Issues. I'm John Channing with Campbellsville University, thanking our audience for being with us once again. Our community, state, and nation continue to be in the throes of the COVID-19 pandemic, and today my guest is one gentleman who is dealing with the pandemic at the regional level on a day-to-day basis, and a name that it has become more familiar to many of us in the Lake Cumberland region. I'd like to welcome Mr. Shawn Crabtree, the Executive Director of the Lake Cumberland District Health Department. Shawn, welcome.
Thank you. Thank you for having me.
Well, tell us a little bit about, first of all, the mission and history a little bit of the Lake Cumberland District Health Department, and then your work as the Executive Director.
Well, all right. Let me begin by giving just a little introduction about myself. Shawn Crabtree.
Certainly.
I'm the director of the Lake Cumberland District Health Department. I've been serving in that role for 2 decades now. Started in almost 2 decades, and certainly COVID-19 has been a challenge for us. Of course, Lake Cumberland, it's a 10-county health district. We'll, I think, talk about that more in a few minutes, but we're the largest health department district in the state as far as number of member counties. We have 10, and we have staff that work doing environmental services, restaurant inspections, sewer inspections. We do work with new mothers. We do immunizations. We do disease investigations of all sorts. So there's a lot of things the health department does. You ask about our mission. Our mission is to prevent illness and injury, to promote good health practices, and to assure a safe environment. We want to improve the health of our communities through public health and through prevention. Of course, the difference between public health and primary care aims at treating individuals one at a time. Public health tries to help move society as a whole toward better health outcomes through better living and through better policies and through disease control, like community diseases that spread, trying to prevent the spread of diseases and so forth. So maybe I'll stop there and we'll get into some more as we go along.
Okay. Now, the relationship between the District Health Department and what we, for example, here in Campbellsville would know as the Taylor County Public Health Department. Explain that relationship and just very briefly.
Well, we became a 5-county district in 1971, and we became a 10-county district in 1982. The other 5 members of our area development district joined the original 5 counties, and we became a 10-county district. In 1971, when the 5 counties formed the district, we were the very first district health department to form in the state. Now, that was before my time, but I am interested in the history. We are very successful as a district in that we still retain all of our member counties. Most of the districts in the state, all of them, I think, except one other, have divided over the years. But we've been able to successfully maintain our status as a full district. So the Lake Cumberland District is the administrative branch for the 10 health departments. And what's that mean? We write the annual budget. We prepare the annual plan for what the organization will do. We handle all personnel matters. We handle all business office matters, and we perform the executive oversight of the 10 health departments. Now, each county still has a local health board. But when you join a district, you turn over a lot of the authority of the operations to what's called the district or the governing board. Now, that's not to say the individual county boards are left out of the district board. In fact, the district board is made up totally of representatives from the member county boards. So it's still the counties are represented. The county judges are all on the district board of health, and then you get additional membership based on your population size. We have 30 district board of health members, so they would be the ones that would approve our annual planning budget and my performance evaluation, the governance oversight. The local boards, they continue to set a local tax rate. There's 2.8 cents per $100 of property value when you pay your property taxes. There's a line on there that says health. That amount goes to the health department. By state law that goes back many, many decades, the counties have to contribute toward the operations of the health department. So 2.8 cents of $100 of property value goes into our district or our operational budget to cover mostly personnel costs. And at the local level, any amount that's taxed beyond that 2.8 cents is retained locally to upkeep the local buildings and grounds. And if they want to do a smaller, what we would call a mini grant project locally, like help fund a walking trail or something, sometimes they do that with the local money. But we're the executive oversight for those 10 boards.
You mentioned the local taxing authority the health department has. Where does other funding come from?
We get 18% of our funding from roughly 18% from federal sources. When I say federal money, most of the federal money flows from the federal government to the State Department for Public Health and down to the local health departments. Now, local health department employees are not state employees, though we're in the state retirement system, kind of like the teacher. The teachers are employed by the local school board, even though they're in the state retirement system. So we're what we would call a quasi state government, in that we're in the state government's benefit package, but we're hired by local board and have oversight by local board. But most of the federal money, as I said, flows through the State Department for Public Health, and then they subdivide it out to the local health departments. That's about 18% of our funding, federal funding that flows down. State funding, 19%. This was as we budgeted last budget year. 21% of our funding comes from that local tax money. 6% of our funding is from separate grants that we write ourselves. We have a grant writer. And then miscellaneous other things represent the other 30%. Fee-for-service collections, self-pay, just various other odds and ends of money. But those are our major revenue sources.
Now, the role of public health obviously has become more visible, I think, and important with the advent of the COVID-19 pandemic. Share with us how the pandemic has impacted you and the Lake Cumberland District Health Department.
Well, it's been completely overwhelming and all-time consuming for us since March. Our role, as health department employees, we conduct enforcement activities already. Our environmentalists, they look at the health and safety of restaurants, hotels, motels, swimming pools. So we're not unfamiliar with enforcement, nor are we unfamiliar with disease investigation. We do what a lot of people now hear commonly. We do case investigations and contact tracing all the time. But generally it's on a smaller scale. It's like a STD or a foodborne outbreak or something of that nature that we do contact tracing. So we have expertise, but never on a pandemic scale where it's been had such a broad impact and such a long-lasting impact. Plus the expectations that the state government has placed on us has been very demanding. Our role has evolved. We started out focusing mostly on case and contact investigations and following up with positive cases. Then, we got into the whole deal where the government was shutting down and restricting things, and they were asking us to be part of that enforcement. We've become advisors to businesses, to local schools, to hospitals. We've helped give advice to long-term care facilities to help them prevent COVID-19 and how to respond when they have a case. We've helped track personal protective equipment. We've provided updates to the media and to the public. I mean, it's been a very complex and ever-evolving situation.
Go ahead.
Well, go ahead. You can go ahead.
I was going to say your website has become one of the most visited websites, at least in my business, and on a daily basis at Campbellsville University, and I'm sure throughout the region. Just the information you're providing, and I might add, I think your staff worked with university staff in preparing a video, for example, to help educate the university community. So another way of just a small example of the many ways that you're partnering. Yeah. How has COVID-19 impacted the 10 counties, and then specifically Campbellsville and Taylor County?
Well, I'm going to start broad and become more specific with my answer. For one, it's impacted me personally. I'm at home on quarantine right now.
Right.
I don't have COVID-19. I tested negative, but one of my coworkers I worked with is positive, and as a precaution, we quarantine ourselves too. We've actually had clusters in 2 of our health departments so far. Casey and Cumberland had to close for a week to sanitize, disinfect, and make sure that any of our staff who weren't positive weren't going to accidentally catch it from someone who was asymptomatic. It's really important that we keep as many of our healthcare workers healthy as possible. So we work them from home during those weeks and do as much as we can. But okay, so you were talking about our website. Our website is where we display most of the information, and it's been really frustrating the way that the media and the way that social media has handled the information. I hate that something that's a public health issue, a pandemic, has been turned into a political issue. Right. And all of a sudden, everyone thinks they're an expert on a pandemic, which none of us are, because none of us have ever lived through this before. And COVID-19 is something that is brand new, and we're just learning about it. It's not been around for decades; it's been around for months. So, it seems that like people that want to look at the data from an extremely conservative perspective, they will say things like, well, so far, this has only impacted 0.6% of our district's population. It's nothing. Why are we making such a big fuss about this? And, I can't disagree with the statement that it's only impacted 0.6 of our district so far. Then the folks that want to look at the data from a very, very liberal perspective tend to look at the projections and want to be alarmists. Now, most of us aren't on either of those extremes. We're in between, but from a public health perspective, we don't want to be dismissive, and we don't want to be alarmists. We want to be realists about the data. So what I look at, sure, 0.6% of our population has been impacted, and that seems small, but what kind of impact has that already had? Well, let's look at that. We know that 3.3% of our cases so far has passed away, so a 3.3% mortality rate. 9.6% of our cases have ended up being hospitalized. Right now, our growth rate is doubling about, I think this morning it was up to about 27 days. It was 23 days when I made my notes, but so, we look at if our cases are doubling every 30 days, where are we going to be at in a month? Where are we going to be at in 2 months? If we've had that level of mortality and that level of hospitalizations, if we quickly double, how many times doubling is it going to take to overwhelm the medical system? And that's what we want to avoid. And really the best way to avoid that, it's not to totally shut down everything, and it's not to go carefree like nothing's going on. The best way is the simple, common sense things that we've been saying. Mm-hmm. Things like wear a face covering. Why? Because it contains your respiratory droplets. It keeps that 6-foot space bubble. We say social distance up to, stay 6 feet away from people. Well, If you're wearing a face covering, it makes that 6 foot space bubble even safer. Don't be around a bunch of people. And if you do, be in and out of that group of people as fast as you can. Lower your risk. Don't be in a confined space with a bunch of people any more than you have to be. Just these common sense things can keep it from blowing up. Now, I've seen that the growth rate for the world and for the nation and for the state, it's starting to slow a little bit again, and I think our data locally will follow that here in a couple of weeks. So, we really just want people to keep up with the social distancing, washing their hands, wearing their face coverings, avoiding crowds, and hopefully, we won't. I say we. I don't have a choice in whether the economy gets shut down or not, but hopefully those kinds of decisions won't have to be made.
Part of our challenge in our culture is we're so instant. We want instant gratification, instant communication, instant answers, and even with data like you're talking about, what is current today, the full ramifications of that data may not be known until 2 weeks, 4 weeks, 8 weeks out.
Well, most of the time when a decision is made, it's about 4 or 5 weeks before we can statistically see the difference. Now, why is that? We're trying to measure, has the face covering mandate made a difference? Well, let me use another example. It's easier to explain. It goes the other direction. When the economy was reopened, the COVID-19 had slowed to about a trickle while things were closed. And as the economy reopened, people know, well, if I catch it, I can start showing symptoms in a few days. We ought to see a big impact immediately. Well, no, that's not the way it works. There'll be a few people that'll spread it, but those few people don't show up really in the statistics. But the 2 or 3 people that they impact, and they get it, and then they spread it. So you get about 2 or 3 weeks down the road until the web of impact is significant enough to start showing up statistically. So, it's generally 3 or 4 or 5 weeks before we really know whether something that's happened is working or not working.
I know that you have probably repeated this endlessly and people have heard it endlessly, but what are the primary symptoms of COVID-19?
Well, the classic symptoms, if you can call it classic, something that just started a few months ago, is fever and coughing. That there's more exotic symptoms like loss of taste and loss of smell and a whole variety of other symptoms. But fever and coughing are the two big ones. Of course, the people that contract COVID-19, depending on your age. Now this is a general statement. It's not always true. Sometimes it impacts young people very harshly, and sometimes elderly people will be asymptomatic. But generally speaking, the younger you are, the fewer symptoms you have, and the older you are, the worse the symptoms are. If you're middle-aged, it feels to a lot of people it feels like having the flu. Of course, the flu kills a lot of people each year too, but the difference between the flu and COVID-19, for flu, you have some residual immunity from the previous season, and there's a vaccine. With COVID-19, this is new to the human species. There's no residual seasonal immunity from the previous season. It didn't exist in the previous season, and there's no vaccine. So it's a totally different thing. That just means a whole lot more people are susceptible to catching it. Right. And there's a lot of things we don't understand about it. I mean, there's certain environments where it spreads very quickly and you wouldn't expect it to. And then there's other environments where it doesn't spread quickly and you think it would. So, there's things about it that we don't fully understand. We do know it can burn through places, though, like it can run through long-term care facilities very quickly. It can run through a church house very quickly. And then sometimes someone in a factory will have it and no one else gets it. So it's kind of difficult to explain. Of course, maybe the factory was doing a good job with the social distancing and the face covering, and things like that. But it's a difficult thing to get our hands around.
And one of the things we're just beginning to talk about, and the doctors and researchers are telling us, are some of the long-term effects of COVID. And I just know enough to be dangerous from reading about it. But some of the patients that are supposedly well then show inflammations around the heart, brain damage, and all kinds of complications, not to mention the inflammation conditions that children are showing.
Yeah, and I'm like you. I know enough about that probably to be dangerous. My medical director could tell you all about it, but
right.
I guess I've been so focused on the immediate response that I haven't thought a whole lot about the lasting consequences. I mean, we're just trying to prevent it from spreading too fast and overwhelm everything.
What should a person do if they're exposed to COVID?
Well, if you know you've been exposed, you can always be tested. Of course, I understand now it's getting a little more difficult again to be tested because doctors' offices are there's starting to be more demand. There's only so many slots available for appointments, and then testing kits and things are becoming more limited. Lab capacity is starting to get backed up, so testing is starting to become an issue again. But if you feel like you've been exposed, to ease your mind, you should be tested. You don't have to be tested. You can wait and see if you show symptoms or not. If you're a close contact, you can be like me. You can quarantine for 14 days, and then if you're not showing symptoms, you're considered very low risk and free to go back to work. Now, I did get tested, but I got to stay quarantined for 14 days anyway. But to ease your mind, if you feel like you've been exposed, you can certainly be tested. Testing just gives you a point in time of information, though. Like if I was exposed yesterday, I might not test positive today because even if I have the virus, the viral load may have not built up enough in my body yet to show up on a test. And just because, let's say I test yesterday and I don't have it, well, that doesn't mean I'm not going to be exposed to someone today that does. So, it tells you in that moment of time if you have it, but that might ease your mind. If you really think you're at high risk of having it, though, you should certainly quarantine yourself until you're certain you don't.
We talked about the wearing of face covers or masks, and that's probably been the most controversial part of the COVID-19 recommendations and ways to avoid, other than maybe the closure of businesses and so forth. But are there accepted exceptions to the wearing of masks?
Only someone with a true medical exclusion should not wear the mask. I mean, I love being from a free country and having my rights, and but man, we sure are stubborn about things like this as a people. And I like to be stubborn about my rights too, but I'm on the other end of this issue, and I can see just how hard my staff are having to work, and every day I think, man, I wish people would take this a little more serious. So wear your face coverings, people, please.
Yeah. And we're doing it not to just protect ourselves, but to protect others as well.
Yeah, it contains your respiratory droplets, so if you do have it and you don't know it, you're not spreading your droplets so far that other people can breathe them in and catch it.
You have touched on this, but what other advice would you give to the general public? Best ways to avoid getting the virus?
Well, don't be around a lot of people. The more people you're around, the more risk someone that you're around has it. If you got to be around people, make it quick. While you're around them, keep your distance. Wear your face covering so you're protecting others, and if they're wearing theirs, they're protecting you. So, sanitize, social distance, avoid crowds, wear your face covering. Kind of the same things we've been saying since the beginning.
Mm-hmm. Should a person have the antibody test, the one that tells you whether you've had it before or not? Is that worth a lot at this point? That may be a medical director question. But,
I talk to my medical director about this all the time. You can, the gold standard test is the nasal swab that they send off to the lab. That tells you if you have it now. All the rest of the tests, the percentage of false positives or false negatives, it may not be that great. But if you want to get it, get it. If it tells you you've had it before, eases your mind, that's fine.
Yeah. What have been the most common origins or sources of COVID-19 hotspots in the Lake Cumberland region where you've had outbreaks of it?
It's evolved. I mean, long-term care facilities was the big one. Places of worship was next. Right now, business related and recreation, like travel, vacations, stuff like that are big ones. You would think it would be family transmission, but on our website, I was looking at it last night. I think that's in third place right now behind business and recreation. A lot of people like to play basketball, youth sports, things like that. Recreation's picking up as a way to be around people who have it.
Yeah. I won't ask you about football, whether we should have football in the fall. We'll let that other folks deal with that.
That's the Department of Education decision, I guess.
Even in the midst of the pandemic, as you mentioned earlier, and we're down to a minute or two, you're dealing with other things. What are some of the other diseases that you actually deal with on an ongoing year-to-year basis?
Well, we deal with, rabies, STDs, other communicable diseases. That's things that we investigate, all the time. Plus the things my environmentalists do to prevent the spread of disease, making sure restaurants are, clean and sanitized and healthy, and septic systems are installed and so forth. But, we still are doing those things. A lot of things are on hold right now because COVID-19 is all encompassing.
How can people contact you, your agency, if they need to ask a question or report a concern?
Well, you can always use one of our web forms or just call your local health department.
Okay. Shawn Crabtree, Executive Director of the Lake Cumberland District Health Department, thank you very much for your time, and appreciate the good work you and your colleagues in public health are doing right now, as well as around the clock year after year. But right now, this extra tier of pressure and work that you are doing, and we appreciate it very much. We wish you well.
Thank you for having me on.
This is John Channing, thanking Shawn Crabtree for being our guest today for Dialogue on Public Issues, and thanking you, our audience, for being with us once again. Thank you.